right, hey, what's up, everybody? Welcome back to the Barbell Medicine YouTube channel. I'm Dr. Jordan Feigenbaum with Barbell Medicine. This is vlog number 19. We've got some questions, we've got some form checks, and at the end of the video, we have directions on how to submit your questions and your form checks so that we can answer them or review them here on YouTube. So let's kick this off with the questions. This is from J.O. Papatia. He says, I recently tore my bicep tendon, it's a distal bicep tendon, on the supinated grip deadlift and had surgery to repair it. Would you say that it is advisable to now avoid the mixed grip? I'm not a formal competitor, but I'm hesitant to use straps and or try the hook grip for other than cleans. So one, hey man, sorry about the biceps tendon rupture. So this is one of those cases where we should definitely look at the literature first on distal biceps tendon ruptures and repair, and then rate of rupture recurrence, and then also kind of see if we can tease out an opinion. Otherwise, I'll just say, we don't know. So the risk of distal biceps tendon rupture previously was thought to be super low, like 1.2 cases per 100,000 patients, and now that's actually over double. Now it's 2.55 cases per 100,000 patients. So we have better diagnostics now. We can more sensitively diagnose this now than we were previously. And so this is from a study that I'll link below from Kelly et al. In 2015. It's published in the American Journal of Sports Medicine. So basically, 2.55 cases per 100,000 patients per year. Last year, or not last year, but from I think it was 2006 to 2010, there were 38,000 cases. Most commonly happens in the age 35 to 54, or in general, the surgeons will say the 4th to the 6th decade. The average BMI was 31. The dominant hand and the non-dominant hand, there's really almost no sort of prevalence difference between the non-dominant hand and the dominant hand. You know, it's a toss-up. Dominant hand is 52% of the time involved, and the mechanism of injury is forced hyperextension of the arm. So forced hyperextension of the arm tends to be the most common sort of mechanism that causes this injury to occur. It happened to about 80% of folks. Again, 95% of these cases were male. They cited that they were doing water skiing, golf, wrestling, basketball, or riding a mechanical bull. Nobody said that they were deadlifting, although if you go look for case reports on biceps tendon ruptures during resistance training or weightlifting, you'll find a couple cases of, in the pediatric population, folks who are on like chronic immunosuppressives or chronic steroid therapy, that can actually weaken tendons. So there's I think 1 or 2 case reports about that. There's also a case report of an older patient who apparently was doing a preacher curl with 25 pounds, and both tendons ruptured at the same time, but he was on a particular medication that predisposes him to tendinopathies. So, you know, the other interesting thing when you look at the evidence on this is there's actually a review on, literature reviews on powerlifting injury case reports. And so they reviewed all the injuries from squat and from the bench press and from the deadlift. I mean, this one review that I'll link as well below showed over 20 different pec major tendon rupture case reports in the time period that they analyzed literature, but not one distal biceps tendon rupture. And so distal biceps tendon is the one down distally, and compared to the proximal biceps tendon, which is usually is much more common. In any event, the question here is, or there are a couple questions that we need to ask here are you at risk for reoccurrence of biceps tendon rupture after the repair? And in general, it doesn't appear so. It also doesn't appear that you're at risk for avulsing the other tendon, even though you've had a tendon rupture on the one side already. So are you at a higher risk now than you were before? I don't think that we can say that. That being said, I think you telling me that you're not a competitor suggests that the overall importance of you developing your grip strength in a mixed grip deadlift is probably lower down the list of things that you need to get good at for general strength and conditioning. If you were a competitor, my answer might be different, but I think that there are very few risks, if any, in developing your hook grip, which I think you should start doing immediately. I think the biggest risk is that your deadlift training might take a small hit strength-wise because the grip has not been trained in lockstep with your deadlift so far. So this is a new grip. This is something that you'll have to train. And so with that in mind, I do think that you can be a little more liberal in your use of straps for deadlifting, going forward. If you were a competitor, I would probably still have you train the hook grip. I would just not be as reliant on straps because we need to figure out a suitable way for you to grip the bar. But if you're not going to compete, I think that we can bypass that step. I wrote an article about this where I kind of hem and haw about, who should use straps, who should not use straps, is mixed grip really more dangerous? And so the TLDR of that is I don't actually think that mixed grip is significantly more dangerous for biceps tendon rupture than anything else, provided you do the thing correctly. I've actually seen a distal biceps tear from somebody who was doing a double overhand grip. This was an axle deadlift. The deal is if your arm is flexed, so if you have a flexed elbow and then it's forcefully extended, then you're at risk of biceps tendon rupture. And sure, if your hand is supinated, the risk is likely higher than if it's pronated, but I've seen it happen both ways. And I think the overall incidence of this occurring, yearly is relatively low, and it's not really happening a lot in deadlifts. And I think that if you are going to do a mixed grip deadlift, that you need to get used to the forces being exposed to those tendons anyway, and build up tolerance to that over time. I would just sort of make the additional note, like, hey, don't bend your elbow prior to deadlifting the bar off the floor. I've seen people do that with the in a double overhand and a hook grip deadlift. I've seen people do it in a clean as well. It's just, usually the weight's a little bit lighter on the clean. It also happens in the snatch sometimes when people will bend their arms and deadlift like that or pull the bar off the floor like that. So overall, what I would do here is train the mixed grip and use straps as necessary while you build your grip strength up, because it is a new sort of way to grip the bar for you. And I think that if you want to bring up your hook grip strength, what you can do is the last set that you're able to actually maintain a hook grip, what I would do is hold the weight for 15 to 20 seconds on the last rep, just to really kind of help your grip strength out there. Okay, next question is about blood donation. So hi to you all at Barbell Medicine. This is from Andy. I'd like to know what your advice is around training after donating blood. It feels like it should have a significant effect on training. Is this true? Are there adjustments which should be made? If so, how long should these adjustments remain in effect? Are there ways to minimize the impact? This guy's 44 years old, 6 foot tall, 197 pounds. Thanks in advance for your advice and for all the great content the BM crew are producing. Now let me say something. We're not the BM crew. We're the BBM crew, or Barbell Medicine crew. But BM, if you work in a hospital, we don't need to talk about bowel movements here. All right, so the Barbell Medicine crew are producing. It's making a real difference to me. Hey, thanks, Andy. But no BMs. Well, on your own time. BBM here. Okay, so the recommendation per the Red Cross says no strenuous exercise for 1 day. As far as where those recommendations come from, this is a consensus panel. This is not sort of like, in our randomized controlled trials or review of all the literature, here's what we came up with. No. The data out there right now is almost entirely on endurance athletes. And so after blood donation, it appears that your VO2 max and your ability to perform at maximum or maximal aerobic output is compromised for up to a week after you give blood. So, but that being said, submaximal training tends to not be affected. The only stuff on anaerobic type exercise, which was done via like a Wingate anaerobic test, and subsequently they were measuring blood lactate levels and stuff like that, suggested that unless a significant amount of plasma was removed along with the blood donation, that was the only time that anaerobic performance suffered. But it's not like these people couldn't exercise. And it's not like they studied these folks up long term to suggest that the adaptations, the training effect that they generated during those subsequent training sessions was compromised either. And then the plasma volume should be restored within 24 hours anyway. So Should you train the same day that you're giving blood? I mean, it's not ideal, probably. That's the only thing I can kind of discern from the review of the literature. But it doesn't seem to be harmful in any way. If it was me and I had to give blood, I'd probably give it on an off day and then train 24 hours later. And then I think that from an anaerobic standpoint, I'd probably be fine. And I would expect that if I was a high-level competitive endurance athlete, that my performance may be a little lower for about a week. But I probably wouldn't think about that either, since there are multiple different factors that go into performance on a given day anyway. And this is just one of many. So I probably just wouldn't think about it, and I would train anyway, unless you had a contraindication from your doctor or whoever else was advising you to give blood that you shouldn't train for another reason, in which case you should always listen to your doctor. This is for entertainment purposes anyway. I mean, we are on YouTube, so I'll link some of those studies below, and you guys can check them out. All right, so let's get into the form checks. This first one is Jordan Folds. Excellent name. First name anyway. Hopefully we're not folding too much here in the squat. I believe this is 385. All right, let's get into it. Walk out, a little extra shuffling, but it's okay. I would have you stand up more at the top. That's first right off the bat, and it does look like you're looking down a little bit too much, and then your chin moves up. So I would actually just lift your chin up a little bit. And then I can't see your stance width. It does look a little wide from here, and your knees, and I can tell it because your knees aren't going very far forward. So I would stand up more at the top, I would lift your chin up a little bit, and I would probably get your knees to go a little bit further forward. The other thing, it looks like you're kind of just bouncing. Oh no, that actually looked okay. Yeah, so a little bit more forward knee travel is what I would do. This is 135 by 4 press. This is Tim, I believe. Your grip's way too wide. So the start of the knurling is about 16.5 inches side to side on a standard power bar, and your grip's way too wide. I would also not do touch and go where you're rebounding the bar off the bottom. I would do each rep from a dead stop. That's what I would do. All right, on to deadlifts. This is looks like 385. Nice sambas. Yeah, I would just make sure to lock out the top. Really squeeze your chest into extension at the top. I'm guilty of not doing that at every rep too, but yeah, hips look to be in the right height because they're not moving up. Bar staying on your legs. Looks awfully light. Make sure to stand up proud at the top. Okay, so this is me. Let's see. Got the it's kind of like a cambered bar, buffalo bar thing. This is 455 plus whatever those things weigh. Ugh. Yeah, that was okay. Depth was good. Bar path was good. I think it's just helping me keep my thoracic spine in a little bit better position. This is 405. I'm going to look at my feet on this one. I shouldn't crop that out. Yeah, feet look pretty good. You see the heels stay on the ground. That's nice. And let's look at the knee travel. That looks good. I like to keep my elbows in place. That would be a good job, Jordan. Yeah, overall, for this variation, the bar shaking like crazy. Looks okay. All right, so this is 315 plus chains. Each set of chains 53 pounds. That's 106. So it's 421. Now, normally I like the chains to have like 2 or 3 links only on the floor at the top. I didn't spend the time to get these things set up perfectly. And I usually like to use about 20% of a 1RM in chain weight for raw lifters. That's my general rule of thumb. I didn't see anything wrong with that. That's why I spent time talking about the chains. All right, so these are pause deadlifts. So this is 495. Yeah, I like this. I just don't like that little head bob. I'd like to yell at myself and not do this little head thing. Yeah, that last one was better. Lock out good. Bar stayed on the legs. Plates didn't move. Look at the logo on the plates. This is 545. Yeah. Nice pause length. Now watch the York plate. That doesn't budge forward. Good. There's that little head bob thing again. I wish I would stop doing that. Yeah, the left side kind of creeped away from my leg on that one, so I'd like to keep it on my legs, obviously. Now this is 595. Yeah, I kicked that one a little forward, and that pause was not long enough, so I'm just Yeah, left side's away from me. Pause also not long enough. You know, it's a little too heavy, Feigenbaum. Oh yeah, and I can't even keep my back in position. So I think that's just a little. All right, here's me doing pin press. So this is 365. I'd had triples today, so I was supposed to work up to a 3 at 9. So I think this is my at 8 set. So in a bench press in general, I like to look at the butt, make sure it's staying on the ground. I'm going to look at the bar path to make sure that it's not going forward. It goes back just like it should. I like the pin press because it eliminates that sort of stretch reflex at the bottom. Really helps with the concentric portion of the bench. My butt's staying down, feet are flat, good leg drive. Yeah, I rated that, I think, an 8 or so. This is 385, so this is actually 10 pounds above my all-time PR, which is 374, well, so 11 pounds. All right, so I'm looking at the legs, good leg drive. Yeah. I can push the bar back more on that second rep for sure. Let's see what the third rep looks like. Yeah, that one's forward. Notice how slow it is. But then it finally goes back. Good. And so that was a PR, though. So that's good. So we're getting close. I think, 450 something is going to fall pretty soon on a regular bench press. And I think a deadlift PR is also in the works. So we'll see what happens here in the next few weeks. But hey, if you'd like to submit your own question to us or your own video for form review, hit us up, media@barbellmedicine.com. Please film landscape, not portrait. And 1080p or higher, you can use like WeTransfer or something to send us the files because they're going to be rather large. For your question or questions, send it to media@barbellmedicine as well. Make sure you include your name, where you're from. And thanks again for watching. Hit like if you dug the video. Leave us a comment below about what you want to see next. And we'll see you guys next time. Later.